Clinical case vignette, gluteal region injury. A 30-year-old male construction worker falls from a scaffold and lands directly on his right buttock. He experiences severe pain in the gluteal region and difficulty walking. He also reports weakness when trying to stand up from a seated position and trouble climbing stairs. On physical examination, tenderness and swelling over the right gluteal region, weakness in hip extension, difficulty rising from a chair, Trendelenburg sign negative, intact sensation in the thigh and lower leg. An X-ray shows no fractures, but soft tissue swelling is noted. Ouch, question 1. Which of the following muscles is most likely injured in this patient? A. Gluteus maximus, B. Gluteus medius, C. piriformis, tensor fasciae latae. Rationale. The gluteus maximus is the primary hip extensor, responsible for movements such as rising from a chair and climbing stairs. Gluteus medius, B, is responsible for hip abduction and stabilizing the pelvis. Piriformis, C, laterally rotates the hip, and tensor fasciae latae, D, helps with hip abduction and flexion. Question 2. Which nerve is primarily responsible for innervating the muscle most affected in this patient? A. Inferior gluteal nerve. B. Superior gluteal nerve. C. Sciatic nerve. D. Obturator nerve. Answer! Rationale. The inferior gluteal nerve, L5 by S2, innervates the gluteus maximus, the primary muscle affected in this case. The superior gluteal nerve innervates the gluteus medius and minimus. The sciatic nerve, C, primarily affects posterior thigh muscles, and the obturator nerve, D, supplies the medial thigh. Question 3. A different patient sustains an injury to the superior gluteal nerve. Which clinical sign is most likely observed? A. Foot drop. B. Positive Trendelenburg sign. C. Loss of knee extension. D. Weakness in hip extension. Answer B. Rationale. The Trendelenburg sign occurs when the gluteus medius and minimus innervated by the superior gluteal nerve are weak, leading to pelvic drop on the contralateral side when standing on one leg. Question 4. Which structure is at risk of injury when giving an intramuscular injection in the gluteal region if not placed correctly? A. Superior gluteal nerve. B. Sciatic nerve. C. Femoral nerve. D. Pudendal nerve. B. Sciatic nerve runs in the lower medial quadrant of the gluteal region and is at risk of injury if an IM injection is placed incorrectly. Safe injections should be given in the upper outer quadrant to avoid nerve damage. Would you